Hi, my name is Dr. Mark Bostrom, and I'm at the Ne-I'm-Shing clinic, and I've been practicing here 17 years. And recently, Commissioner Anderson asked me to prepare this video just to share some insight on monkeypox, this new phenomenon that's been infecting some people in the United States for the past few months, just because there's been some community members contacting the clinic and having questions about it. So I hope today I can alleviate some fears, give some general information, and also refer you to the Minnesota Department of Health website. They have a nice monkeypox section that can give you some information if you have more interest. I want to just sort of overview, just hopefully can alleviate fear. There's really not much to worry about at this point. There's not much risk in this community at this point, and of course we'll keep you updated as time goes on. Monkeypox is a virus of the variola family. It's endemic to Africa. It has never occurred naturally in the United States or Europe, but recently there has been a small number of infections. Fortunately, there have been no fatalities. The disease is relatively rare and relatively mild. There's been 44 documented cases in Minnesota as of today. Almost all the cases have been in the metropolitan Twin Cities area. All the affected cases have been men between the ages of 18 and 55. In the United States, it's predominantly been propagated through homosexual men. It doesn't mean it can only affect them, but that's so far how it got initiated and so far how it's been spreading. There's two stages to the disease. The first stage is rather general. It can present with flu-like symptoms such as fever, headache, muscle aches, lymph node swelling, and fatigue. And sometimes that can last a person can be exposed and not have symptoms for up to a couple of weeks. But once they develop the fever, usually within a day to 3 days, a person will develop a rash. It typically presents as little red bumps and will blister. It can present really anywhere. Generally, it's more in the genital region, but it can go over the entire body. It eventually will scab over and sometimes can last up to a month. It can be slightly painful, can be itchy, and it's really the lesions on the skin that are most contagious. So a person is contagious for the time period that they have that until the scabs or the lesions are fully scabbed over and started to heal. I think it's important to know how it spreads. It really spreads mostly by close, personal, skin-to-skin contact. It's got to be prolonged. It can't just be a handshake. So it's usually occurs through, so far, through sexual intimacy. You can also get it not only by direct contact, but you can get it through touching objects such as clothing. If someone slept in a bed and the bedding wasn't washed, and the next night someone else slept in that bed, and the preceding night it was somebody that had active monkeypox, you could potentially become exposed and infected. But it's mostly through direct, prolonged skin-to-skin contact. So it's not highly contagious. And again, in Minnesota, those currently at risk are primarily homosexual males, primarily those who have multiple sex partners. There are treatment available, usually used for those who have more severe disease. There's a few different antivirals that are available. People have called and asked about vaccines. There are 2 different vaccines that have been made for this particular virus. However, they're not readily available. They're predominantly used as a post-prophylactic exposure in people that have been exposed and that people that are high risk. Even if we had plenty of vaccine available, we wouldn't run around using it preventatively because right now the risks are so low. So I guess want to emphasize that it's rare. It's primarily affecting homosexual men in Minnesota. It's mostly in the metropolitan area, and it has not caused any fatalities. In terms of testing, if a person has an unusual rash and has concerns, they can contact the clinic. Basically, it's just a dry probe that we do, and we send it down to the Minnesota Department of Health. I believe the Mayo Clinic is starting now to do testing, but testing is limited, but it is available. The treatment, again, is not readily available, and it's only for those with severe disease, or else people that are at risk for severe disease, like people under the age of 8, people with skin conditions that might predispose them, pregnant or breastfeeding patients, or people who are immunocompromised. Some of this gets pretty detailed, and I don't think it's really helpful to go through all the details. It really is on us here. If someone does come in and has a problem, we would work with the Minnesota Department of Health in terms of testing, in terms of getting a vaccine or post-exposure vaccine, and in terms of getting treatment if it was necessary. So that's basically all I really have to say. I just want to reassure everybody that right now it's not an issue. For those in the community, if you are in particular a homosexual male, you need to be obviously cautious. We all need to be cautious with who we're sexually intimate with, and just be aware of unusual rashes. And if you have developed such a rash, don't get too worked up. It's probably not due to monkeypox, but if you have questions, you can come in, and we'll evaluate you and treat you as appropriate. Thank you.